So Anna, if you are speaking, we can't hear you.
Hi. Oh, thank you.
There you are.
Thank
Thanks.
you, Ali. I'm not seeing the slides. Can we start through the slides? Great. So I'm going to talk about the Vaccine Outreach and Counseling Program, which we announced last week. The reason why we are announcing this program is because many people have questions and concerns about COVID-19 vaccines and want to speak to a healthcare provider about getting vaccinated. This conversation takes time and effort. So we are partnering with some of the Medicaid and Medicare Advantage plans to compensate providers to do proactive outreach to eligible patients in their panel who are not vaccinated, counsel them about the importance of vaccination, and help them arrange vaccination. This means that if the client or if the patient agrees to be vaccinated, then you're going to help them set up an appointment. If they don't want to be vaccinated yet, then you can inform them how they can access vaccination in the future. Next slide, please. The program is reimbursing practices for proactive outreach to unvaccinated individuals, and it is reimbursing for the counseling component of that proactive outreach. So we are funding $50 if the counseling is done by a clinician, and then this means that includes at least 3 minutes of clinician time. It is 25 if the counseling is done by a non-clinician using a script approved by the billing provider. I am seeing some comments in the chat about the volume. Unfortunately, this is the maximum volume of the headset. So if you can please turn up your volume in your computers, that would probably help. That's how we have solved it for an earlier meeting today. Once all the necessary steps have been completed, providers can bill for a complete counseling session. The health plans will have various start dates in September and will run until the end of October of 2021. Next slide, please. So later today, Dr. Morse is going to talk to you about the Commissioner Advisory to use every opportunity. The advisory is for people that the doctor or the practice has in front of them, physically or via telehealth. This program, the VOCP, is for the practice to do proactive outreach to people who are not in front of them, with the explicit purpose to counsel for vaccination. This is important because the VOCP program cannot replace nor be provided in conjunction with Medicaid or Medicare billable services. Another distinction with the advisory that you're going to hear about later is that whereas the advisory is for any patient, the VOCP is exclusively for the people that the provider receives from that the provider receives from each participating health plans and vaccinated patient list. So this means that the billable services are triggered by a list that is provided by the health plan to eligible providers. There is only one counseling session that is reimbursed for each patient. So because of these, it's important that you wait for the health plan to give you the list. Next, please. So for the encounter to be billable, all of the following steps must be completed. The first step is confirm that the patient is eligible. The second step is to deliver a complete counseling session. And the third step is to have complete documentation in the patient's medical record. I'm going to go through more details about these three. Next, please. To confirm eligibility, the health plans are going to be giving providers the unvaccinated patient list provided by each participating health plan. People who are not on the list are not eligible for available complete counseling session by the provider. The second piece is that they need to reach out to eligible patients on the unvaccinated list. So one thing that we want to stress is that it is important to do the outreach if the patient is already at a patient visit, or if it's in front of you, then they're not eligible for the VOCP program. For these patients that you have in front of you, you're going to hear more from Dr. Morse about the commissioner advisory. Then the last step for confirmation of eligibility is that you must confirm that they have not received any dose of the COVID-19 vaccine authorized or approved by the FDA, or who are not fully vaccinated with the vaccines authorized for emergency use by WHO. For this effort, you should accept a patient's statement that they have been vaccinated, and you should not proceed to to provide a complete counseling session unless the patient agrees that they're unvaccinated. I want to stress this piece because we expect that some patients who are unvaccinated will say that they're vaccinated to you, and we should believe the patient when they say that. Vaccinated patients are not eligible for available complete counseling sessions, so this is why asking this question at the beginning is so important. Next, please. So now let's talk about the content of the counseling session. If the patient confirms that they're unvaccinated, the provider or your designee can proceed to deliver a counseling session. This is a minimum 3-minute oral conversation with the patient, during which the provider or designee must do all of the following. You need to do a strong recommendation for COVID-19 vaccination, unless it is medically contraindicated, in which case the counseling session is not billable. You must counsel the patient on the safety and the effectiveness of the COVID-19 vaccines in a way that is consistent with the New York City Department of Health guidance, and you must respond to the questions that the patients may have. You also must arrange for vaccination. So if the patient agrees to vaccination, you assist the patient in booking a vaccine appointment, ideally at your office, but if you're not offering vaccine, then at another location or at home. And if the patient does not agree to vaccination yet, offer them information on how they can obtain the vaccine at a later point. Next, please. Sorry, I think we skipped step 3. Yeah, thank you.
Apologies, there it is.
No problem. So once you complete a counseling session, the provider or the designee must document the following items in the patient medical record. They need to document the provider or the name of the provider or the designee who performed the counseling session, how the counseling session was performed, the content of the counseling session that shows that the conversation included information on vaccine safety and effectiveness, and that the content of the counseling session showed that the patient was provided with information on how and where to get vaccinated, and that interested patients were offered assistance in arranging vaccination. Next, please. So in our website, we have a provider toolkit. You're going to have the slides so you can see how to access this toolkit via our website. But before I start going into the FAQ and screen share with you how it looks like, I want to talk about the script a little bit. So next, please. Next one, please. So in the toolkit that I'm going to show you in a few minutes, I'll show you the frequently asked questions. Those are about 20 frequently asked questions on patient eligibility, compensation, documentation, and reporting. So we'll come back to these during the Q&A session. But let's go to the next slide so I can talk a bit about the non-clinician script. So the way how this is going to work is that if you are the primary care provider that has been assigned to a patient by a health plan, and that patient remains to be unvaccinated, then the health plan is going to give you a report with all of your assigned patients who remain unvaccinated. Then those patients become eligible if they are still unvaccinated and confirmed to be unvaccinated at the time that you call them. They are eligible for the program. We would love for the program to be implemented by, or for the counseling to happen by a clinician. But we know that not in every case you yourself can do it. So if you received a list, you can have the counseling session be delivered either by a fellow clinician, and in the toolkit we include all the types of providers who are eligible for the clinician rate, or you can have non-clinician members of your team do this. However, it is important that if you have a non-clinician member of your team doing the counseling, those members of your team must be following a script that is approved by you, because they would be calling the patient on your behalf to make a strong recommendation for vaccination on your behalf. So we are including in the provider toolkit a sample script that you as the billing clinician can adapt. So there is a voicemail script just if you're making the phone call and the patient didn't pick up. But just want to stress that a voicemail, a robocall, a text message, a chat, none of that constitutes a billable counseling session. So we're just providing you like with a sample that we would leave on the patient's phone, trying to encourage them to call us back. Then we go into the call script, which is the one that actually complies with all the elements of the counseling session. It includes the vaccine information. It includes more details about how to help the patient do vaccine scheduling, either on site for a home appointment or for an off-site appointment. And then how you can, what are the options that you can provide to a patient who doesn't want to be vaccinated yet, and still kind of meet that criteria about helping a patient arrange for vaccination. And then there are some closing comments related to masks and things like that. So this is intended to be a starting point for you to provide a script to your non-clinicians. But of course, if you want to use it to guide your own conversation or the clinical conversations with the patients, that's also acceptable. So now I want to share with you how the toolkit looks like, so that you know that we're going to be responding to several questions today. But in addition to that, you can also see responses to a lot of the questions that we have been receiving through our partners. Are you able to see right now the toolkit? You are? Okay.
Yes,
So
thank you.
when you go into the COVID-19 providers page of our health department website, we have here under vaccines, the COVID Vaccine Outreach and Counseling Program Toolkit. When you click on that one, this is what you're going to see. There is a program overview that is really important because it's going to outline all the requirements for this program to be billable. Then it is also going to move into the frequently asked questions. So it includes how do I know which patients are eligible, what health plans are participating in the program, and this list here is a bit outdated. We have had 2 more plans I agree to the program since last week. So the new ones are United and Emblem, in addition to Health First, Metro Plus, Empire, and Amida Care. We also go into whether you need to ask the patient if they have been vaccinated, or if you can skip that. How often do you need to expect that the patients who are in the unvaccinated list tell you that they're actually vaccinated? What should you do if patients in the unvaccinated list already are telling you that they already received the vaccine? What should you do if the patient received a vaccine abroad, so it's not authorized or approved by the FDA. We also go into accommodations for patients with whom you cannot have an oral conversation due to a disability, and who you can speak to in case the patient is a teenager. Then we go into compensation, clarifying that these needs to be a conversation, so recorded messages and texts and all of those options do not qualify. It goes into what happens if you have a patient that is unvaccinated but is not in your list, so you cannot be compensated. It also goes into some details about what happens if you end up doing the counseling session in multiple encounters with pieces at a time. We are reinforcing the importance of meeting all the criteria for the complete counseling session in order to be billable. We are stressing that this program cannot be part of any other billable encounter. So this needs to be a fully standalone counseling session that you are providing. So that's why you cannot just add it when you have the patient in front of you for another purpose. We go into the titles of that would be eligible for the clinical outreach rate, and then the requirements for a non-clinical outreach rate. What happens if you are tag teaming with your non-clinical staff for the counseling session in terms of billing? What happens if Medicaid and Medicare start reimbursing for counseling for vaccination? And then also clarifying that the reimbursement is not dependent on the patient deciding to get vaccinated. A successful counseling session is a session where you actually had the conversation with the client, but we understand that not all the clients are going to decide to get vaccinated. We go into the details about billing if the client actually decides to be vaccinated and you vaccinate them. And then more logistics about the timing of when the counseling session can happen. The third section of our FAQ is documentation and reporting. So can the practice staff help you document? And then what happens if you talk to the patient and the patient says, I'm already vaccinated, and so they're not eligible for this counseling session, but then you agree with them of a time that they can come to the office for their next well visit, and at that time you have proof of vaccination for that client. And then finally, we go to the non-clinician script that I mentioned to you, where we are highlighting all the ways how you and your staff can assist the client in doing, in identifying a vaccination place and some of the talking points about vaccine safety and effectiveness. And then we close this toolkit with information about additional places in our webpage where you can find additional talking points and information. In addition to this toolkit, which includes the program notice that really kind of outlines the parameters of participation in the program, your health plan is going to also include additional information outlining the specific CPT codes that you would need to use for the list that they are giving you. So this is one part of what you would receive along with your unvaccinated patient list towards the end of September or beginning of October. And then you would receive additional information from your plan about the billing component. So with that, I'm going to move to questions in the chat. So Zach and Ali, let me know what's the best way to do that.
Sure. So thank you, Anna. So go ahead. Thank you.
I was only going to say I've been starting to answer these questions in line as we go, but other than that, I defer to you.
Okay, so let's see some of the questions that have come through the chat then. Zach, could you maybe ask me the questions, and then that way I make sure that I go through all of them?
Sure. The first question we have here is, can we order less than 1,000 doses of Pfizer? And I think the answer to that is that's outside the scope of this program. Is that right?
That's correct. I would defer to other people in maybe in attendance later to respond on this question.
The second question that we have on here are non-primary care entities eligible to participate in the program? Questioner specifies that they're a nonprofit entity providing clinical services and linking clients to medical care and encouraging vaccination. And Anna, maybe the answer to this is to talk a little bit more about how entities should be informed of who their eligible patients are.
Yes, so the health plans are going to be assigning patient lists to each provider. And what we have heard so far is that the bulk of the health plans are going to be assigning the list to the primary care provider of the client. So if you appear as a primary care provider for the HARP or Medicaid or Medicare Advantage patient, you are likely to receive a list. If you don't have assigned patients by the health plan, it's unlikely that you would receive a list, but I'm not going to say that it cannot happen, but we don't think that's going to be very likely. And then after the provider receives a list, the provider can tag team with people in their care team to do the calls. But it really depends on how each of the health plans is going to be assigning the lists.
Anna, it's not the next question in line, but quite a few people have asked, what codes do I use? And I think the answer to that one is, well, I'll let you answer that.
Yeah. So each health plan is going to have different codes because we're rolling these out so fast. We couldn't have like a single code for the program. So each health plan, when they send you the provider, the patient list, they would also provide you with instructions for the billing.
We got a question about whether residents qualify as providers, and if they have an MD, I believe the answer to that is yes, right, Anna?
Yes, they would be unlikely to receive the patient list, but as long as they have an MD degree, they would qualify for the clinical service. If they are part of the care team, even if they don't have an MD, they could qualify for the to provide a counseling session that is scripted if they're a non-clinician.
The next question we got is who's considered a designee, and that's in relation to the rule that the counseling needs to be provided by a provider or their designee. They wanted to know front desk staff, RNs, and I think the answer to that one is anybody who is operating according to the provider's script and under the provider's supervision may be a designee. Is that right?
Yes, that's correct. And some designees may be clinical providers. So the provider that received the list may be on vacation and they may want to ask a fellow provider in the practice or the RN or um, other of the clinicians that we're authorizing to bill for the clinical rate. But you can also designate it to non-clinical staff. And in that case, it would be a $25 rate rather than the $50 rate.
We got a number of questions in this area, and I'll let you give the real details here. But the first one said, who's authorized to assess vaccination status? And the second part of the question was, can it be done by front desk staff or nursing staff, or does every step need to be done by the billing provider? And I think this feeds into what you described about tag teaming and what needs to be done by a provider in order for it to be billable at the provider rate. Would you like to reiterate that?
Yes, I think that that point is really, that question is really important because um, we would love for the counseling to happen with the clinician, but of course we are not expecting that the clinicians are all going to have the chance to go through the list and start making the phone calls. So it is absolutely acceptable that you would assign, for example, the front desk staff to make the phone call and to confirm eligibility. And then once you have confirmed eligibility, a clinical member of the team can do the counseling. And in that case, that's fine. We only ask that for it for the clinical rate to be billed, the clinician needs to spend at least 3 minutes doing the counseling. Otherwise, the rate that would apply is the non-clinical rate.
The next one we got is, what if when we call the patient and they say they're vaccinated, but then start to ask questions about a third dose? And I think that's maybe two questions. The first one is the bottom line requirement for the patient needs to be unvaccinated in order for this to be a reimbursable service, but that's maybe a different answer than what a clinician would do in that case.
Yeah, that's correct. So if the patient tells you that they are already vaccinated, then they're not eligible for the clinical counseling session. If they start asking other questions about, now that they have the doctor on the line, they want to talk about some additional stuff, we will defer to what the practice would want to do when they have a patient asking for questions that are relevant for their care, such as getting a third dose.
We got a question, and I know some more here, that says, can you please provide more detail about the unvaccinated patient list? Who are these patients going to be? It will be all individuals in New York City covered under the health plan. And I think some of that answer is going to be the health plans are going to have some managerial discretion in who they put on those lists. Is that a good answer?
That's correct. And and to give you even more detail, the health plan regularly matches their membership against our city immunization registry. So the health plans have updated information about who in their membership is vaccinated or not vaccinated. So what we're doing with this program is that we are providing a match specifically for this program to the health plan so that they can have an updated and vaccinated list that then they can divide up among the primary care providers that are the assigned providers for their patients or members.
And Anna, to clarify, you just said primary care providers, but in fact, some plans may be assigning patients to folks who are not explicitly PCPs. Is that right?
Yeah, that's correct. Like we are giving discretion to the plans to who they assign the patient.
Yeah, and that's a couple questions we've had later. Is this only PCPs? And that'll vary. Someone asked here, and this is a good question that maybe can be answered generally. If these services can't be in conjunction with other billable services, does that mean it has to be a separate visit? Maybe good to reiterate how we anticipate these services being delivered.
Yes, we anticipate that the bulk of these services are actually going to be outreach calls, right? You receive a list, you have the phone numbers of these clients, and you're going to reach out to them to offer to have this counseling session. So we don't think that there are going to be that many cases where you would be in front of a client that doesn't have an appointment or intend to have an appointment with you. So if the client is already in front of you and wants to have for an appointment, this program wouldn't apply. So I would think, like, when we think about this, we're really thinking about phone outreach.
Yeah, we have a question here. Are we required to only counsel patients on a list received from the MCOs? Some concerns about the attribution list from the MCOs sometimes being out of date or incorrect, and valid concern. Anna, can you confirm that this program, for unfortunate administrative reasons, is limited entirely to patients who appear on the MCO lists?
That's correct. That's correct. That's the way how we are able to operationalize this program in such a fast way is by collaborating with the MCOs and relying on their ability to distribute the patient lists.
A couple questions about updates on which health plans and payers are participating here. And I believe that is, you've distributed a link where that most recent information lives. Is that right?
Yes, we are keeping that information updated in our website. And right now we have none of the plans has started to distribute lists. I just want to clarify that. No one should have received a list from their plans yet. But we have Health First, Metro Plus, Amida Care, we have Emblem and United, and I am missing one. So let me just make sure that an Empire for the Health Plus product. We also have several other plans that are in the final process of allowing us to name them publicly. But the 6 that I just mentioned are the ones that are more advanced in the process.
We got a great question here is how is the insurance plan going to know to send a provider a list? Does the provider need to sign up for this program? And there's nothing providers need to do to affirmatively become eligible to participate. Is that right?
Yeah, that's correct. I think that what we are noticing is that if you have a very large panel, you're likely going to be receiving a notification from, like receiving a list from the provider, from the health plan a little bit more directly. If you do have patients assigned to you, but your panel may not be as large, you may want to contact the health plan to inquire about whether you can receive a list. So each plan is going to have a little bit of a different approach.
There's a follow-up question here, and actually regarding residents. I know we said a moment ago residents are MDs or DOs and therefore are eligible as providers. There's a clarification here that they may not yet, in fact, have state medical licenses, although they have the MD. Are we confident residents are fully qualified as clinical providers under this program, or do we need to go back for that?
No, if I think under the we can think about it, but if they are not yet, if they don't have a license yet, they may they may be on the non-clinical list and needing to have a script. But let me go back to the clinical team advising this process and see if we need to update that. But as the guidance stands right now, they would be eligible only as non-clinical.
Okay, thank you. Um,
I see
Sorry, I
one
lost
here
my.
that I think I covered. That is maybe the patient's PCP is out and there is another provider covering. If the patient counseling from the covering provider, would they still be eligible for reimbursement? Yes, I think we that's a good question for the health plans, and I'm gonna take note of that. The the provider that receives the list is eligible to designate anyone else to do the outreach. So they would be eligible to do these, and I will clarify for an edit to the toolkit whether it would be the provider who received the list, the one billing, or the one that actually performed the counseling.
We've got a question here and some similar ones. If a provider is part of a capitation agreement, can the provider bill and be reimbursed for counseling? I think all questions like that are going to be answered by talk to your plan. And if the plan puts you on a list, that means that they're making you eligible to seek and receive reimbursement.
Yeah, that's correct. It's important to clarify that if you get a list from your plan, this program is being fully funded with city dollars. So this is not part of what the plan would pay you for Medicaid or Medicare billable services. So we are expecting these to be paid on top of the capitation. But if you have doubts about it, just please confirm with the health plan once they send you the list.
We've got a, go ahead.
Oh no, I wanted to do a time check with Ali because I know Dr. Morse is also talking about the advisory. Do we have time for a few more questions?
Yes, thank you. I think maybe one more question and then we will need to move on to our next presentation. Thank you.
Okay, then I will say one here that, yeah, if the patient, we call the patient and patient informs the provider that in fact they are already vaccinated, even though the list said they're not, is the provider eligible to receive some sort of other compensation for their time spent on that call?
No, if the patient states that they're already vaccinated, there is no eligibility for compensation. We hope that now that you have the patient on the line, if the patient is due for other stuff, maybe you can chat with them about when's the next time that they want to come for their other medical needs. But we would not be providing compensation out of this program if the patient has already received at least one of the FDA authorized vaccines.
Great. Well, thank you both for the presentation and for the Q&A. And we will still be able to hopefully address some further questions in the Q&A box here in the WebEx and get to any outstanding ones if we do have time at the end today. But in the interest of time, we're going to move on to our next presentation from Dr. Morse about the Commissioner's Advisory directing healthcare providers to offer vaccine information and the new program to offer compensation for counseling.
Thank you, everyone. And please make these calls as soon as you start receiving the list. We're really, really eager to partner with you in getting vaccination to a higher rate here in New York.
Okay, so Dr. Morse, I think we're all ready for you if you're able to speak. If not, I guess we can return.
Sorry about that.
There you are.
Can you hear me
No
okay now?
Yes, thank you.
Perfect. Okay, I was just thanking Anna and thanking you, Ali, but I suppose you didn't hear that. Appreciation to both of you, though, for facilitating and presenting. And again, as Anna underlined, our real hope with the provider kind of compensation and proactive counseling program is to support you all as providers in doing the very challenging and time-consuming work of reaching out to patients and having conversations with them to answer all of their questions about the vaccine and strongly recommending the vaccine. So again, just really want to emphasize how much we're interested in supporting your efforts to get us closer to our vaccination goals for the city. And I'm going to be brief in my presentation this afternoon. I would love, of course, if there are more questions for the compensation and counseling program to go back to those questions if we aren't able to get to all of them in the chat. And then certainly, of course, if you have questions about the Commissioner's Advisory, happy to answer those as well. So with that, let me go ahead and jump into the slides. I'm going to be focusing on the Commissioner's Advisory this afternoon. Next slide. And provider recommendations are really central to this era in the vaccination campaign. I want to start by just acknowledging all the hard work that many of you have done to get us to the huge landmark of 5 million New Yorkers being vaccinated as of last week. That was a huge milestone that we passed, and so thankful for your partnership in it. And yet, as you know, this is a big city. We still have many millions more New Yorkers that have yet to be vaccinated. And our belief, and the evidence supports this, is that providers are really going to be the critical key factor in getting us closer to our goals for vaccination for all New Yorkers. And it's really, really important that I emphasize, again, how critical provider recommendations are. Many of the patients that I've spoken with, many of the providers I've spoken with, have described just how important the conversation is and just how important it is that we as providers use our unique and privileged role having longitudinal relationships with patients and members of communities, and oftentimes being trusted members of those communities, not always, but trusted members of those communities, especially for patients with whom we've had long-term relationships. And that means that us bringing up the vaccine and strongly recommending it has a unique power as opposed to other sources of information that patients might have. So again, as you see on the slide, provider recommendations matter. I can't emphasize that enough. And I know in many ways I'm preaching to the choir, but this is a really, really important point because we have to recognize that the information we share is particularly powerful. as we are one of the most trusted sources of COVID vaccine information, and strongest predictors of vaccination is a recommendation from us as providers. And all of the evidence shows that over and over again. Next slide. I wanted to emphasize some data yet again here. This is from our community health opinion poll from June of this year. And it just describes in more quantitative terms what I just described. It really describes what some of the reasons are for folks who have decided not to get vaccinated yet. I bet you're seeing this in your practice, that patients are worried that the vaccine was developed too quickly. And most importantly, what I really want to highlight in the bar graph that you see below is that patients are waiting to learn more about the vaccine before deciding, and that's where our role comes in as providers. And this is a large number of folks, right? Upwards of 60+% of folks are waiting to learn more. These are the folks who are unvaccinated, of course, in the poll. And as we know, there are lots of different reasons why patients might not be sure about the vaccine, but more information is going to actually influence the decision and opinion of many patients, again, as described in this particular graph chart and poll. So we do believe that, again, because of this evidence and many other sources of evidence, that providers making the time to have this conversation, and then also making sure that patients who want to learn more, as you see in the second question in the bar graph, patients who want to learn more have a trusted source of that information, right? So again, just underlining the power of this. Next slide. So with that, I recognize that many of you are already aware of the Use Every Opportunity campaign that the health department has been leading for the past few months, and I want to recognize and emphasize how important that has been in offering tools for providers to make sure that they feel comfortable bringing up the vaccine in every space possible, and also feel comfortable actually speaking with both colleagues and patients about the vaccine. The reason for the Commissioner's Advisory that was issued and took effect last Thursday, September 9th, was really to help to bring more attention to the Use Every Opportunity campaign and to strongly urge providers who are serving patients across New York City to offer information about the efficacy, availability, and administration of the COVID vaccine during every patient visit. We believe very strongly, again, that providers have a unique superpowers in this particular instance of giving patients the information they need, evidence-based information about the vaccine, and actually making the strong recommendation that patients become vaccinated. Next slide. So what's in this Commissioner's Advisory? The advisory really asks that whenever you are encountering an unvaccinated patient during your visits with patients, during your encounters, whether those be scheduled outpatient encounters, emergency department encounters, or hospitalizations, that you take it upon yourselves as providers to 100% of the time offer the information about the efficacy, availability, and administration of the COVID-19 vaccines. If the patient agrees to be vaccinated, we are strongly encouraging you to offer the vaccine, or if you aren't able to vaccinate the patient on the spot, that you give the patient information about where to get the vaccine. And we're really encouraging you to document this as a way to comply with the Commissioner's Advisory. Documenting this in the medical record is critically important. And as Ana Gallego described, this Commissioner's Advisory is specifically focused on the patient sitting in front of you, the patient that you are already having an encounter with, and asking and really advising strongly that you integrate vaccine recommendations and information into those existing encounters. And this is in partnership with and integrated with, but distinct from the payment that you may be eligible for through the payment program. The vaccine outreach and the vaccine outreach payment program. Next slide. So who does this advisory apply to? The advisory applies to all providers who serve patients over the age of 12. So if you serve folks who are eligible to be vaccinated, so serving patients ages 12 and over, and providers who work in hospitals, emergency departments, outpatient clinics, and primary care offices, as well as, again, the specific categories of clinicians that are covered by this commissioner's advisory. These are folks who are physicians, physician's assistants, nurse practitioners, or midwives. Next slide. So how can you comply with this advisory? It is very much acceptable for staff in your offices and teams act as your designee to offer this information. And it's also, of course, totally possible to do this through both in-person and telehealth visits. If the patient is not vaccinated, again, please continue to provide this information. But if the patient, until the patient is fully documented as being vaccinated. Next slide. Are there any exceptions to this advisory? So, of course, there are situations in which this advisory wouldn't apply, and that's when the patient, of course, is dealing with a life-threatening emergency, unable to engage specifically for medical reasons, and if the patient is younger than the age of 18, of course, for folks who are between the ages of 12 and 17, this information should be given to the parent or guardian of the minor. And then if there is a medical contraindication, of course, then this advisory would not apply. Next slide. These are a list of folks who have shown their support already for this particular advisory and have actually been very supportive of the rollout of this program. Next slide. And just in terms of next steps for this advisory, you can certainly learn more, again, by looking at our providers page, which I believe is also in the chat. And again, we're really appreciative of all of your hard work and are at the same time just encouraging you to make routine conversations about COVID vaccines a part of your existing visits, hospitalization, conversations with patients during hospitalization, and encounters with patients in the emergency department as an example of how you can use every opportunity to encourage patients to become vaccinated if they are unvaccinated. So thank you again for the opportunity to speak more about the advisory and how you can comply with it, and happy to answer any questions if there are any. If there are more questions, of course, for the payment program, happy to hear additional comments from Anna on those as well. Thanks so much. Back to you, Ali.
Thank you very much, Dr. Morse. It looks like we did not have any new questions come through that were specific to the advisory, but we do still have quite a few for Anna and Zach if in their last 10 minutes they would like to respond to some of those. So Zach, maybe I'll hand it back to you since you were doing such a great job moderating before. Thank you.
Happy to, and I've been going down this list and answering questions, but we still have quite a few to go. So Anna, if it's all right, I'll just start reading these off to you again.
Yes.
So we have a number of questions here in the general vicinity of how am I going to get my unvaccinated list? Who is my plan going to send it to? How is all of the communication in this program going to work? Let me know if we have any answers to that, but I think a lot of those are going to be you will communicate with your plan in whatever way you communicate with your plans generally.
Yes, I think that's the most accurate question. As the plans, we announced the plan last week, so the plans are working out the details of exactly how they're going to be communicating. I encourage you to continue to send your questions to the New York City Reach email. And that way, as we have more details, we would be responding on those more specific questions. But as of right now, we don't have the specific details of how you're going to receive your unvaccinated list. We anticipate that it's going to be very similar to how you typically communicate with the health plan for things like gaps in care reports and that type of things.
We have a question here. Is this program applicable to individuals in congregate care facilities? And I think the answer to that is going to be it is applicable to all individuals who meet the criteria outlined in the FAQs if they appear on a list from a plan. Is that a general valid blanket statement?
Yes, and the provider that is likely going to receive that congregate setting resident is going to be whomever is the primary care assigned provider by the plan to that resident. So that would be the person who would be receiving it.
This is a great question. A collaborative clinic that has primary care and behavioral health wings wants to know if they can call it a clinical visit if they have an LC or LMSW, make that call.
That's a great question, and I received that same question earlier from a colleague. So we are actually going to take back that question to our internal clinical team, and um, eh, if we do an update to the program notice, then right now those titles are not included, but we will discuss internally before the health plans start sending out the patient list with an updated program notice.
We got a really important question here. Someone wants to know if there's a required number of proportion of people on the unvaccinated list that a provider has to contact. Are they required to contact individuals who are not their patients? And the answer to this one is no one's required to do anything. This is an optional add-on program that would be very helpful, but this is not a mandate. Is that fair to say?
Yeah, that's fair. What would be great is that if you receive a list and there's some patients that you are not going to contact, it would be great if you let the health plan know so that that patient can be reassigned to someone else, because the health plan is assigning every person exclusively to a unique provider. So if they're in your list, they're in nobody else's list. And if you're not planning to contact them, then we would love for that person to be reassigned.
There are quite a few questions here on the question of the hour. When am I going to get my list? And since this keeps coming in, I think it's worth reiterating this one more time that we're working on it, but we don't have an answer on that.
Yeah, that's correct. We expect it to be more towards the end of September, beginning of October. And I believe that there were some questions in the chat about whether we would extend the period. So right now we are expecting all these outreach to be a massive collective effort that happens primarily throughout October. And as we see how many counseling sessions are happening, then we will reassess. Something that's going to be very important is that you build your health plan as soon as possible, because that's the only way that we will know if the program is actually counseling people, right? And that's information that we will look to make decisions about extensions. But as of right now, it is expected to end on October 1st.
Some additional questions still coming in about how will these lists be emailed or who is it going to be sent to? We don't have any answers for that. Is that right? Because that's the plan is going to administer themselves the way they generally do.
Yes, correct. And Zach, I think I'm seeing some older questions that I wanted to tackle as well. I saw
Please.
a lot of questions related to pharmacists. So the provider can delegate that receive the list can delegate the list to anyone in their team. If the person in their team is a licensed pharmacist, then that person would, if that pharmacist does the counseling session, is eligible for the clinician rate. And there have also been a lot of questions related to payment while the patient is already at the office for a well visit or a sick visit. And I just want to stress that if you are already providing a billable service to the patient, you cannot bill for this service. We would love for you to do the counseling, but you cannot bill for the counseling if you are already in another Medicaid or Medicare billable encounter. And because of that, it is highly unlikely that these are going to be face-to-face encounters. We are thinking that the bulk of this is going to happen by telephonic outreach.
Anything else you wanted to make sure we got addressed, Anna?
Let me see really quickly. I think someone asked if only MDs can do the counseling session. That is not correct. And I've also seen a lot of questions related to PCPs. So there are going to be providers who receive the lists from the health plans. Most likely, that's going to be a primary care provider. However, once the primary care provider or the healthcare provider receives a list from the health plan, there are multiple people who are eligible to provide the counseling session in a way that is billable. So that billing provider, that is the one that has the list, can ask their nurses, can ask their colleague physicians, they can ask pretty much anyone in their practice to do the counseling. If the people who are doing the counseling are in our list of approved clinical encounter, a clinician outreach, then they would be able to bill for a $50 counseling session. If they're not in the list of the people that we are authorizing as a clinical outreach, then they would be eligible to bill for the $25 rate, but they must use a script. And I see that someone is bringing up again the question of whether this is a facility and pro fee component. I actually need to go back and do a little bit more research on this one. Thank you for bringing it up. And this also applies for the people who ask how these would apply for an ACT program or for a care coordination program. So I'll do a little bit more research and work with Ali to see if we can have an answer out or an update of the FAQ to include those questions.
Great, that sounds wonderful. We are coming up right on 2, so I want to thank all of our attendees for joining us today, and Anna, Dr. Morrison Beck for your presentations and facilitation of all of these questions. We will be sending out links to the slides and recording that will be posted on the provider page of our website by Monday, and can also include any additional FAQs, Anna, that you might want to address via email to all attendees at that point or any point in the future as well. So thank you again to those who were able to join us, and we hope to see you next time. Have a good afternoon.
Thank you, everyone.